Hello, everyone. Welcome to a new episode of One Vision and our brand new season, the FinTech Fuse. This is Theo, your host for the episode, along with Stephanie Foster, my partner in crime. Yay! So today, we are very delighted to welcome DeShawn Stevenson, Director of Pharmacy Operations at Walmart and co-founder of BabyFever. Now, this is a completely different topic and direction as what we normally do, but that's the fun part of hosting the show. So welcome to the show, DeShawn.
Thank you. Glad to be here.
All right. So tell us a little bit about what you do to kick off our conversation and also your vision behind BabyFever. I like the name, by the way.
Awesome. So BabyFever is an intersection of health tech and fintech. So we're aiming to break down barriers for individuals on their family building journey. Our vision is rooted in accessibility, so making fertility and family building services available to everyone, irrespective of financial constraints. So we want to empower users by providing a seamless platform connecting them with providers, agencies, and financial institutions. As it relates to myself, the reason why I founded it, I decided to become a single father by choice. So I have a gestational carrier, and our due date for my little girl is going to be May 1st. But during my process of going through the road of becoming a single father by choice, I encountered a lot of African-American women that were dealing with PCOS, endometriosis, and I didn't really realize how prevalent it was in our community until I started to realize that this is a barrier to me actually having a child on my own or being in a relationship or co-parenting, whatever route that I decided to go down. So I made a vow as a person of faith to, basically pay it forward to the next person that was going to be able to have a kid, to be able to not only kind of educate them on different things that was happening as far as health disparities related with themselves and infertility, but then also being able to work through the financial constraints that prohibits many from actually assessing care, which is financial constraints.
I love that. So DeShawn and I met here in Atlanta through the FinTech ecosystem. Actually, shout out to Red from ATDC, who actually initially put us in contact, and we've really gotten the chance to get to know each other. And I got to hear a lot more about what he's building at BabyFever here in Atlanta and his own personal story of jumping into parenthood.
Yes.
And figuring all that out on his own, which we're so proud of you, DeShawn, and we're so excited for May 1st. You have a date now. This is so exciting.
Yes, I'm excited.
So you recently pitched at FinTech South, right? You're a part of the Innovation Challenge and one of the finalists. Congrats again on that. Tell us more about that experience. What was that like for you?
Awesome. So the FinTech South Innovation Challenge was a fantastic opportunity to showcase BabyFever's unique approach. We presented how our platform addresses the financial aspects of family building. So being a part of this challenge allowed us to interact with industry leaders, gain valuable insights, and highlight the importance of integrating FinTech into the health sector. One of the things that I learned initially was this was an opportunity to educate the FinTech community as far as the issues that were affecting those that were in the family fertility and family building ecosystem. So I'm already in the ecosystem, but people didn't know that it cost, $15,000 to $30,000 to actually do an IVF cycle. And most people had to either run up their credit card, or they had to go and establish a account, or they had to actually get a loan to get this done, or ask friends and family. So all of that is part of the financial process. And, that's a barrier when someone wants to actually have a child. So this was a great opportunity to, get poured with different resources. As I come from a healthcare background, I was able to kind of build on my financial or FinTech skill sets, definitely. By being a finalist, and I had amazing mentors that were able to help me craft my pitch deck, which, although I didn't win or excel to the next level, the moment that I did the FinTech competition, that night I literally applied to Mount Sinai with the pitch deck that I was able to create because of my mentors there, and then I was accepted to an incubator, like literally right after that. So that night, applied. The next morning, I got accepted to Mount Sinai, and now we're in an incubator. So I definitely thank the FinTech South group for mentoring me during that time and helping me refine my value proposition. So it's definitely helped by being a finalist.
My jaw dropped when you were talking about the part about financial constraint. And I have to admit, I had no idea. I do have 2 kids of my own, very lucky parents. The part that surprised me when I had my first one, and then still surprised me when I had my second one, was the hospital bill. I remember because both of them I had to go through C-section, and I remember I was on bed rest for majority of my first one. And I got told I need to go to the hospital the day before my scheduled surgery to quote unquote settle the bill. I'm like, what do you mean by settle the bill? They wanted to run my credit card to make sure that everything will go through in case there are some things that will come back from the insurance. Thank goodness the insurance did cover every single dime of it, because the bill was $30,000.
Oh my God.
I was like, okay, that was expensive. And that was one child. And that was the first time I realized, I'm like, wow, what if you don't have insurance? I mean, I was lucky and I had amazing insurance from my workplace at that time. But what if you don't? What if you have other complications? What if, your credit card can't support all of that? And my biggest thing I remembered was, here I am supposed to be on bed rest. I am stressed. We're trying really hard to keep the baby in. And you asked me to come early to run my credit card. It just, none of that process felt human.
Yes. Transaction.
Right? It was all a transaction. And I compared and contrast to some prior experience I had in the UK. I lived there for a while. And I remember when I had to go see a doctor, it was on the weekend. I was able to make an appointment. They spent a lot of time with me and they took care of me. And it wasn't like you walk into the doctor's office, what's the first thing they ask you? What's your credit card? They didn't do that. And I felt like, oh, someone actually cared about me as a patient. I did not get that feeling here in the US. And it's scary to think in other places in the US with people who have less access, right? What are they going through? So I want to talk to you about equity, because that's something that I had experienced and seen, I read a lot about, and I know that's something that all of us are very passionate about. Walk us through, what are some of those disparities in care? Why do we have it the way that we have it? And it's becoming a critical issue in the US. And what on earth is going on? Sorry, that's a loaded question.
No problem. So health disparities in fertility care are glaring. With unequal access to services, often due to financial limitations. So this creates a system where only certain demographics can afford these life-changing services. So specifically in the fertility and family building ecosystem for the last, I would say 40 years, it's primarily been a, high socioeconomic class, mainly white, that have been donors, surrogates, or access to donors and surrogates, as well as access to fertility services. So before, I think right now with, more, especially minorities going to college, gaining additional skill sets, gaining kind of more competitive jobs that will allow them, and having jobs that allow them to or pay for the services as well, you're seeing more access to care, or more people get access to those services. But health equity is critical as it addresses these disparities and ensuring that everyone has a fair chance at building their family the way that they desire. So one of the things that is so pivotal that ended up publishing yesterday is ACRM, which is, again, the parent organization or the main organization as it relates to fertility and family building, just widened what infertility means. So infertility used to mean if a traditional heterosexual couple was less than the age of 35 and they had been trying for 6 months, then they were designated as infertile. So actually for 12 months, they were designated as infertile, and they were deemed, you need to go ahead and go to a reproductive specialist. If they were over the age of 35 and they've been trying naturally and it still wasn't working, then they were supposed to go to the reproductive endocrinologist. But They actually expanded the definition of infertility now. So it's not based on relationship and it's not based on sexual orientation. So now it says if you have to utilize donor gametes, which is basically eggs, or you have to utilize donor embryos in any part of your process, then you're deemed infertile. So that will hopefully open up the door for more insurance coverage, as it is not given for certain communities, such as single parents by choice or LGBTQ+. So hopefully that will open up the door again for more access and more equity, not only from a racial standpoint, but also from a sexual orientation standpoint. But ultimately, the facts show that 1 in 6 will experience infertility worldwide. So it's not a black and white issue. It's a human issue. 1 in 3 cannot afford it. So most people go to the fertility clinic, and then once they're told what the bill is, first off, you're going to have to pay at least about a $300 consultation fee that's not covered by insurance just when you do your first initial consultation at the fertility doctor, which is your number one barrier before you even go down the road of figuring out how much everything else is. And also, Black women are twice as likely to be infertile for multiple reasons. We have an increase in the amount of chronic diseases, obesity in our communities. As I mentioned earlier, prevalence of endometriosis, PCOS. I was talking to my friends the other day, and my mom had a hysterectomy at 39. So with us waiting until, I'm 39, with us waiting until our late 30s and early 40s to have kids, most of the people in my aunts and my mom had hysterectomies around this time, because of reproductive issues. So it just kind of goes to show that reproductive issues always existed. It's just we're waiting until later to have kids because we want to have a family. We want to build our career. We want to buy the house. We want the white picket fence. We want the marriage. We want all of these different things. But, we're not educated enough on what's actually happening to our body throughout those moments of trying to wait until the right time. And there's never a right time to do anything. So one of the things that we're trying to do is basically try to help, as there's changes that's going on with insurance, as there are changes with the definition of what infertility is. We want to move with those changes with the BabyFever platform so that everything's already set up for everyone, no matter what your parenthood journey may be.
Thank you for sharing that, DeShawn. I'll say that I, just as Tia, I also have 2 children. Both, birth was able to happen naturally. So I haven't personally dealt with this stress, but I have many close friends, family members, colleagues, right, who have gone through that process or are currently going through that process. And it is emotionally stressful and draining. And that's just one part of it, right? Like without even thinking about the financial impact of how do I make this happen for my family, or how do I make it happen for myself when it's something that you so deeply want. So my question to you is how do we change that status quo? Like what role does financial services play?
So changing the status quo involves dismantling financial barriers. So financial services play a pivotal role in providing solutions like affordable loans, insurance coverage, and tailored financial plans. The growing awareness and collaborative efforts within the FinTech and health tech sectors give hope. The shift towards inclusivity is gaining momentum as well. So looking at ways to show underserved communities ways to finance their financial journey would be pivotal. So, we are thinking with our BabyFever platform, being able to invite collaborators. So, there's certain parts of the process that, you may have an aunt that wants to contribute towards your reproductive law fees, which may be $1,500 to $2,000. Invite your aunt to contribute to that. So we know that in certain communities, they're used to pulling resources together, especially for a common cause. The reason why I thought about that is we had a sister actually contact us on the BabyFever platform because her younger sister was having multiple miscarriages, and she didn't want her sister to go through another miscarriage again. So they had already went through the IVF process. They had embryos. So, she had already lost 2 of them. They didn't want to risk her losing any more of those embryos that they had so preciously ended up getting. So they ended up contacting us to get a surrogate. which ended up being a lot more affordable than they actually had originally quoted. So they thought they were going to spend between 150 to 200. I connected them with an agency. I think they're going to spend maybe 80 or 90. So they were like, oh my God, thank you so much for connecting me with, them. So, financial resources, are important and imperative, and that could dictate whether someone has one kid or two kids based on their financial makeup. So we're seeing men come as well to the platform. I've had men where, their wives have, had a baby, but bled out and it had an emergency hysterectomy. And, they were able to still be fertile and have embryos, but they needed a surrogate as well. So I paired them up with an agency. We have another couple that they have to get an egg donor and a surrogate. So walking them through that process and what that looks like. So it's pretty much cliche, specifically in the minority community, as far as getting donors and egg donors and surrogates and all of that stuff and what it looks like. And these are people that have, really good jobs and, making good money and, they did everything right. They got married. They did this, and it's like, next is the baby, but where's the baby? Has been the common question that a lot of them have had. So being able to kind of provide a resource and say, hey, I understand what you're going through, and I'm going to help you navigate what that looks like, has been great for our customer discovery as we build out our platform so that we know exactly what people need. But, a lot of people that come already have resources to pay for things like this, right? So it's a luxury still. Even within the minority community. So how do you access the people that don't, that may need, financial assistance or, connections to prescription programs if they're low income to provide some of these fertility services. So we want to provide as many resources as possible through our financial platform. Again, loans, prescription medication assistance programs. We're working with the Cade Foundation, so they provide grants up to $10,000 for couples and also single people that need to go through the IVF process. So the main thing that we see is if we can just educate our community as much as possible about the resources that are out there, then at least they have a chance at getting one step closer to having their baby.
I love that you're looking at education on both pieces of it, right? There is one part of educating society, the rest of us, on how big of a problem this is for so many in America that a lot of people are not aware of, right? So you have that education piece of what the problem is that you're solving with BabyFever, but also education on the other end, because you've essentially created some sort of a marketplace where you're matching all of these resources with people who are in need as well. So you've got to educate them on the resources that are out there to truly help them get to the other side of this pain point of becoming a parent. And I am so in awe of what you're building, DeShawn.
Thank you. I appreciate it.
I agree. It's amazing. As you were talking through the question of access and education, I wonder, wouldn't this be something that employers would be interested in, right? Because oftentimes we look for bankable moments. What is a bankable moment? When there is a change in life events, when you have a baby, when, you become widowed, where your children goes to college or getting ready to go to college. Those are all big life changes that people look for help. Wouldn't it make sense if employers do more in this area as well?
Some employers are doing more, but there's still so much that has to be done. So some employers are working with their insurance companies to make sure that the insurance companies are adding fertility coverage. But a lot of the fertility coverage is not inclusive to different environments. It's still based on a traditional heterosexual relationship. So if you're doing, again, single parent by choice, you're not going to be able to access those benefits typically. And then if you are doing LGBTQ plus, you don't qualify as well because, a lot of the IVF has to be done on your surrogate or, certain procedures have to be done on another person that's not covered. So what we are seeing is some companies are offering reimbursement, but even that's a barrier. So for example, my company offers $20,000 for surrogacy reimbursement, but obviously you have to pay for that up front. and then get reimbursed. So my technicians or, other hourly associates can't afford to save up to $20,000 to wait until that is reimbursed. So, what do you do in those types of situations? So we've seen one of our kind of fertility benefit companies have more of like a preloaded card. So I think if we go the employer route, it will have to be something where we have a preloaded card, or we already have a agreement with certain agencies or certain clinics where that money will kind of preload on a card, and then we'll be able to work directly with the agency on distributing those funds. We've been trying to go back and forth as to different strategies to increase access to care. But the reimbursement is common amongst adoption and surrogacy amongst employers. It's just a barrier because you have to wait. You have to save all that money and then wait to get reimbursed.
It goes to show how much more work we still need to do in rethinking policy and rethinking how we still have not evolved with time, unfortunately. This and more. We can go on that forever. Looking forward to next year and beyond. What are some of the things that you are focusing on? I'm curious. And before we let you go, if there's one message that you would like to convey to our audience, what would that be?
Awesome. So moving forward, we're focused on enhancing user experiencing, building out our technology, expanding our network of providers and agencies. That's why I'm here at the conference today, and advocating for a more inclusive financial solutions. So our message to the audience is simple. Everyone deserves the opportunity to build the family that they dream of. And at BabyFever, we're committed to making sure that that's a reality through both innovation and also inclusivity. So we, again, as I mentioned, got accepted to the Diversity Incubator at Mount Sinai, one of the world's best hospital systems based in New York City. So we're going to be working to do a lot of customer discovery at one of their hospitals in East Harlem. And we're going to get a mentor. She actually wrote a book called Countdown. Her name is Dr. Shana Shaw. So she basically is a reproductive epidemiologist there, and she's said that by 2045, most couples will have to do IVF just due to the decrease in the amount of sperm counts. Sperm counts have decreased 50% over the last 40 years just due to the food that we're eating, environmental concerns, like all of these different factors that we're not talking about. So we hope to bring her in as a mentor and hopefully as an advisor as we grow the BabyFever platform, as well as our pitch was accepted by the National Science Foundation. So we're moving on to phase one of applying for grant funding to build out our technology. So we're taking steps as much as we can. But one of the main things I'm going to say is just advocate for yourself. When you're going through the fertility and family building journey, and, if you can connect with one person throughout that journey that can help you, please connect, ask your fertility clinic for advice, ask your OBGYN for advice, ask your primary care doctor, do they know anyone? Because we cannot overcome infertility and also kind of the emotional strain of family building without collectively working together to overcome these challenges. But everyone wants a baby, and a lot of people want a baby, and that should be a human right and a dream. And I don't think that we should kind of have all of these different barriers that prevent someone from being happy and being able to share that same joy and experience of being a parent.
I love everything you just said, and congratulations again for May 1st. We look forward to getting updates from you, DeShawn, and thank you so much for spending time with us. If people want to reach out to get more information about what you do, where should they go?
Perfect. They can reach out to us at babyfever.com, and we have a community form as well as a contact form, or I'm on LinkedIn as well as at Dr. DeShawn Stevenson, and look forward to hearing from you guys. If you need any help, let me know.
Thank you so much. Appreciate it. And for the rest of our listeners, thank you so much for joining Stephanie and myself for another episode of One Vision. We will talk to you all next week.